Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Congenital malformations. We look at the part 2. So here we will focus on the Dandy-Walker. So Dandy-Walker malformation, there is a large posterior fossa and it is characterized by a triad of there is the presence of the hypoplasia, and this is nothing but of the vermis as well as a cephalad rotation, and this is nothing but of the vermian remnant. So there is a hypoplasia of the vermis and cephaloid rotation of the vermian remnant. Next comes the cystic dilation. So cystic dilation is present and this is of the fourth ventricle which extends posteriorly, or the fourth ventricle, and this is nothing but extending, so extending posteriorly. So there is a triad of hypoplasia of the vermis and cephaloid rotation of the vermian remnant. Next comes the cystic dilation of the fourth ventricle which extends posteriorly. Then is the enlarged posterior fossa. So it contains the enlarged posterior fossa, and this is with a torcular. There is a torcular, there is a torcular, there is a lambdoid inversion, that is the torcular lying above the level of the lambdoid due to the abnormally high tentorium. To learn and grow daily like this, please do subscribe.